This is the Nutrition During Lactation module, part 2. We will begin by talking about vitamins and minerals. We had previously, in part 1, finished talking about the macronutrients. The consumption of more food to meet energy needs and the increased absorption and efficiency of nutrient utilization that occurs during pregnancy are generally adequate to meet the needs for most nutrients when good food choices are made. Again, when there's balance, variety, and moderation in play. There are a few exceptions. However, vitamin and mineral supplementation is routine and is even more important in vulnerable cases, including food insecurity, alcohol, tobacco, or other substance dependency. Supplementation is also important in cases of anemia, in a strict vegetarian or a vegan diet, or when there are simply poor eating habits. Reinstitution of prenatal nutrition supplementation is fine, but in general, regular supplements during the lactation period that meet all of the 100% daily requirements is probably a better choice. Again, women can always check with their healthcare providers and let them know of all supplements taken. Many women consume less than the recommended amounts of calcium, magnesium, zinc, vitamin B6, and folate. And many new mothers may have stopped taking their prenatal vitamin. If a nutritional deficit is suspected, prenatal supplements generally do not include a significant amount of calcium. And in addition, during lactation, 250 to 350 milligrams of calcium is transferred daily from the mother to the neonate through breast milk. Patients should be apprised of the need for additional supplementation to meet the requirement for this key mineral. It is important to emphasize that vitamin and mineral supplementation cannot replace a healthy diet. It's also important to recognize what we mentioned earlier, that variety in a diet is key. Variety is what allows all of us to consume the full scope of vitamins, minerals, and nutrients. A varied diet provides a varied nutrient base. So let's take a look at a typical supplement as compared to the percent daily value. As you can see from the slide, and it should be noted that not all nutrients are included, if women continue taking their prenatal supplements during lactation, they are ensuring for the most part that they are pretty close to meeting the daily recommended amount. And of course, that doesn't account for food eaten. A general multivitamin or mineral supplement is recommended once a day if it doesn't exceed the daily intake by more than 20%. And that's important. A lot of supplements, when you look at the label, go way beyond 20%. One thing to consider that doesn't come into play a lot is that during times of disasters, such as hurricanes on the East Coast or, blizzards in the Northeast, tornadoes in the Midwest, earthquakes, in California, the World Health Organization does recommend a daily micronutrient supplement during emergency or disaster situations for pregnant and lactating women, especially in regards to iron and folacin, and that's just something to keep in mind. Looking at the table, the components are on the left, so it lists a few vitamins, a few minerals as well. It lists what the amount is in a typical supplement and what the form of that vitamin or mineral is found in. So if you look at vitamin A, the vitamin A in a supplement is going to be in the form of beta carotene, and that would be in the amount of around 4,000 international units. And vitamin D3 would be found as cholecalciferol. Vitamin B12 would be cyanocobalamin. Vitamin C is ascorbic acid. Zinc as zinc oxide. So again, different micronutrients come in different forms in supplements. So as you can see on the right-hand column, that includes the percent daily value for pregnant and lactating women. So if you look at vitamin A, around 50% of vitamin A would be provided in this supplement. You would receive 100% of vitamin D3 in this particular supplement. Vitamin E is pretty low, but folic acid you'd be getting 100%. So it's important to look at the label of any supplement that a client is considering taking and really evaluate whether or not it truly is the best choice of a supplement for them. So looking at pregnancy versus lactation, looking at the macronutrients, So again, this is a table that is going to show the movement of a macronutrient from pregnancy to lactation. So the first one, we look at a rise in carbohydrates. So during pregnancy, there's really only around 175 grams needed per day. Again, that's an average. And that bumps up to around 210 grams per day in lactation. So fiber also is bumped up as well, not by a lot, but it does go from around 28 grams per day to around 29 grams per day. And if you'll remember earlier, we did mention that fiber is one of those nutrients that is sorely lacking in the American diet. And in fact, the typical American diet really only does provide around 15 grams per day. So if we're looking at the polyunsaturated fatty acids, the omega-6s, those remain stable from pregnancy to lactation. And if you look at the omega-3s right below, those actually drop, and those go from 1.4 grams per day to 1.3 grams per day. And protein remains the same from pregnancy through lactation. Now water, you can see that water jumps up a lot. So even in pregnancy, around 3 liters a day or 11 to 12 cups is what is recommended. And then if you look at lactation, you're almost up to 4 liters a day, and that's from 14 to 16 cups on a daily basis. And that's why it's really important for women to get in the habit of really drinking water throughout the day at meals and at snacks, and just considering that at every meal or snack to drink some water. Keep in mind that weight loss during lactation does not usually impact the quantity or quality of breast milk. But maternal deficiencies in magnesium, vitamin B6, folate, calcium, and zinc have been described during lactation, as we mentioned earlier. Both fat, such as vitamins A, D, and K, as well as water-soluble vitamins, specifically vitamin C, B1, B6, B12, and folate, are secreted into breast milk, and their levels are reduced in breast milk when there's a maternal vitamin deficiency. Not just if it's a little low, but if there's a specific deficiency. Fortunately, these vitamin deficiencies in breast milk respond to maternal supplementation. So on the other hand, calcium, phosphorus, and magnesium levels in breast milk are independent of maternal serum levels and diet. Maternal factors such as stress, anxiety, and smoking can decrease milk production, but the quantitative and caloric value of breast milk does not change with dieting and exercise. Continuing on, just to highlight, you can see in green where nutrients decrease during breastfeeding. In red, they are increased. Black, they remain the same. And in fact, in some nutrients like vitamins A, C, chromium, copper, and iodine, these are needed in quantities nearly double that of a non-breastfeeding woman. So as you can see, looking down the chart, thiamine requirements from pregnancy to lactation remain the same. Riboflavin, vitamin B6, vitamin B12, and vitamin C, those requirements are all elevated during lactation. For niacin and folate, those actually decrease slightly from pregnancy to lactation. If you look at vitamins A and E, those micronutrients need to be elevated during the period of lactation, and vitamin D remains the same. Vitamin K also remains the same as well. That is just not included on the slide. So when we're looking at pregnancy versus lactation, when you look at the minerals, and again, I've only included about half of the minerals just to demonstrate how a lot of the nutrients are increased during the lactation stage. If you look at calcium, calcium remains the same. You're going to have the same requirements in the prenatal period as in the lactation period. Although the thing that is different for a lot of these is that the needs are higher when the mom is 18. So if you look at iodine, zinc, and potassium, all 4 of those minerals have increased requirements during breastfeeding. And for iron and magnesium, well, those, as you can see from the table, those requirements drop. Those are higher in pregnancy than when you look at lactation. One thing that I feel it's important to comment on at this point in the slide is just the changes over time that I've seen in terms of the macronutrient and micronutrient requirements. So it is really critical that as professionals that you remain up to date with your information, whether it's lactation information, nutrition information, health information. It's really important that you stay current. One way to do it is by at the very least by reviewing the dietary guidelines that come out every 5 years. These numbers have changed over the years, just in the years that I've been a dietitian. And I know that these numbers will continue to change over time. So these are the nutrients affected by low maternal status, but they can respond quickly to reversal. Vitamin A, D, K, thiamine, riboflavin, vitamin B6, vitamin B12, vitamin C, selenium, choline, and iodine. And I could talk about each one of these individually, but for the purposes of this course, it's just important that you know that these are some of the nutrients that may be affected if a mom isn't including enough of these food sources in her diet. And again, this is where balance, variety, and moderation come into play. Nutrients that are not affected by low maternal status are folate, zinc, iron, calcium, phosphorus, magnesium, and copper. When discussing carbohydrates, what are 3 things to remember? Well, keep in mind that around 210 grams a day, and this is up from the prenatal stage, is appropriate. Around 45 to 65% of daily calories should come from carbohydrates, and about half of the grain intake should be whole. Limiting added sugars is important, as all added sugars really do is contribute empty calories without any other nutrition. On average, breastfeeding has a calorie cost of what per day for a single baby? So on average, breastfeeding costs around 500 calories a day. To prevent neural tube defects, all women of childbearing age should consume 400 micrograms per day of folate from fortified foods like cereals and other grains or supplements, or preferably both. And beginning 1 month before conception, women should really boost their intake and eat folate from foods in a varied diet that reaches around 500 micrograms a day. And that's the perfect scenario. However, remember that I've said this before, that 50% of all American pregnancies are unplanned. You can see the increased levels recommended for pregnant and lactating women as compared to just non-pregnant, non-lactating women. Many lactating women, actually all lactating women, should be viewed as pre-pregnant women. One thing to keep in mind is that the critical time when the neural tube defect is happening is frequently prior to or just barely when a woman discovers that she's pregnant. By the time that a woman discovers she's pregnant, that's right around the time when it is too late to adjust her folic acid intake and prevent the neural tube defect. And the neural tube defect that we are referring to is either spina bifida or anencephaly. Both the US and Canada, we both have well-established fortification programs, although there is no global standard. So around the world, intake can vary widely. During pregnancy, demands for folate increase due to its role in nucleic acid synthesis. To accommodate this need, the FNB recently increased the folate RDA from 400 micrograms a day for non-pregnant women to 600 micrograms a day during pregnancy. Now, this level of intake might be difficult to achieve through diet alone, and the American College of Obstetricians and Gynecologists recommends a prenatal vitamin supplement for most pregnant women just to ensure that they obtain adequate amounts of folic acid and other nutrients. The major sources of natural dietary folate are legumes, green leafy vegetables, liver, citrus fruits and juices, and whole wheat bread. It is also available in nuts, beans, peas, dairy products, poultry and meat, eggs, seafood, and grain. Spinach, liver, yeast, asparagus, and Brussels sprouts are also among the foods with the highest levels of folate. And compared to naturally occurring folate in foods, well, the synthetic form of the vitamin, which is folic acid, which is normally the form found in fortified foods and supplements, is almost twice as well absorbed. So moving on to vitamin B12. strict vegetarians and vegans are at greater risk than lacto-ovo-vegetarians and non-vegetarians of developing vitamin B12 deficiency because natural food sources of vitamin B12 are limited to animal foods. Fortified breakfast cereals are one of the few sources of vitamin B12 from plants and can be used as a dietary source of vitamin B12 for strict vegetarians and vegans. Since vitamin B12 crosses the placenta during pregnancy and is present in breast milk, exclusively breastfed infants of women who consume no animal products may have very limited reserves of vitamin B12. They can develop vitamin B12 deficiency within months of birth. Undetected and untreated vitamin B12 deficiency in infants can result in severe and permanent neurological damage. The RDI for vitamin B12 for all women past the age of 14 for the general population is 2.4 micrograms per deciliter. For pregnant and lactating women, it jumps up a little bit at 2.6 micrograms per deciliter for pregnant women and 2.8 micrograms per deciliter for lactating women. Vitamin B12 is a water-soluble vitamin that is naturally present in some foods, added to others, and is available as a dietary supplement as well as a prescription medication. So vitamin B12 exists in several forms and contains the mineral cobalt. So compounds with the vitamin B12 activity are sometimes called cobalamins. So a healthy DNA is dependent on vitamin B12. It also helps nerve cells and red blood cells be healthy. It's naturally found in animal products, but it's particularly high in shellfish, organ meats such as liver, some game meats like venison, and other fish like sardines or trout or herring. And in the United States, primary sources of vitamin B12 are usually they're mixed dishes containing fish, meat, or poultry. They can be milk beverages and ready-to-eat fortified cereals. Usually, infants do get enough vitamin B12 through breast milk. Vitamin B12, it's a water-soluble vitamin. It's transferred through the placenta to the baby during pregnancy, as well as through human milk postpartum. Infants who consume breast milk from a mom who obtains adequate amounts of vitamin B12, or I do need to state that infants who drink infant formula will receive enough vitamin B12. However, if a breastfeeding mom is deficient in vitamin B12, there's a possibility that her infant may also become deficient. We've talked about veganism or breastfeeding moms on a strict vegetarian diet, but keep in mind that breastfeeding mothers who have had a malabsorptive bariatric procedure, such as a gastric bypass surgery, or if they've had pernicious anemia, which is a low number of red blood cells caused by a deficiency of the vitamin B12, or who have certain GI disorders, they may not be able to absorb various vitamin minerals, including vitamin B12, as well as folic acid and iron and calcium. And this is where it comes into play that it is important for moms to keep their healthcare providers in the loop. So healthcare providers should monitor these mothers for nutrient deficiencies, including vitamin B12. So the American Dietetic Association recommends supplemental vitamin B12 for vegans as well as lacto-ovo-vegetarians during both pregnancy and lactation. And hopefully that will ensure that enough vitamin B12 is transferred prenatally as well as via human milk. Pregnant and lactating women who follow strict vegetarian or vegan diets should consult with a pediatrician regarding vitamin B12 supplements for their infants and children. So vitamin D is very, very limited in nature unless you count the source of the sun. And fortified foods actually do provide most of the vitamin D in the American diet. And almost all of the U.S. supply of vitamin D is through milk, and it's voluntarily fortified. It should be noted that the vitamin D RDAs are set on the basis of minimal sun exposure, and they are 600 international units across the board. Women are at increased risk of vitamin D deficiency when they don't have a lot of exposure to sunlight, if they follow vegan diets, and if they have darker skin. And in the case of vitamin D, low levels of vitamin D during a pregnancy can actually result in the baby experiencing a deficiency as the baby does accumulate vitamin D in the prenatal period. Infants do not get enough vitamin D from breast milk. Breast milk alone does not provide infants with an adequate amount of vitamin D, even if mothers are taking vitamins containing vitamin D. Shortly after birth, most infants will need an additional source of vitamin D. It should be noted that currently, the AAP recommends supplementation of 400 international units daily, beginning in the first few days of life. Supplementation should continue until he or she is weaned to at least 1 quart or 1 liter of whole milk per day. Whole milk should not be used until after 12 months of age. Previously, supplementation was not thought necessary. Many parents do not supplement. Many physicians may not recommend. The World Health Organization recommends no sun exposure for babies under 12 months of age. However, the Center for Disease Control and Prevention, the CDC, and the American Academy of Pediatrics do concede to minimal indirect sunlight and sunscreen, of course, although the sunscreen does interfere with vitamin D synthesis. So what does sensible sun exposure mean? Well, it means around 30 minutes a week with a diaper only. It means 2 hours a week fully clothed, or 10 minutes a day once a week. The AAP feels strongly that all children should be kept out of the direct sun as much as possible and wear sunscreen while in the sun to avoid long-term risk of sun exposure, which may contribute to skin cancer. Sunscreen, as we mentioned, does keep the skin from manufacturing vitamin D. All formulas sold in the United States have at least 400 international units per liter of vitamin D. So, if a baby is drinking at least 32 ounces of formula, vitamin D supplementation is not needed. Again, whole milk shouldn't be used until after the age of 12 months. So like I said earlier, vitamin D is very limited in nature, and most of all of the vitamin D supply in the American diet is available through the U.S. milk supply and is voluntarily fortified. So vitamin D is found in fatty fish like salmon, tuna, mackerel, which are among some of the best sources. There's also beef liver, cheese, and egg yolks, which provide small amounts. Even some mushrooms do provide vitamin D. Almost all of the U.S. milk supply is fortified with 400 international units of vitamin D per quart. However, with foods made from milk, like cheese or ice cream, those specific types of milk are actually not fortified. Vitamin D is added to many breakfast cereals, like breakfast cereals seem to be a vehicle of choice for many, many nutrients. And it's also added to certain brands of orange juice. You can also find vitamin D in some yogurts and margarines and soy beverages, but you do want to always check the label. So let's move on to vitamin K. Do infants receive enough vitamin K from breast milk? No, they do not. Breast milk is low in vitamin K, and breast milk from mothers who are taking vitamin K supplements at times is also low in vitamin K. Now, infants born in the U.S. are routinely given a vitamin K injection, and this is due to low infant stores at birth per the recommendation of the AAP. Really, placenta transfer only accounts for small amounts of vitamin K. And in human milk, again, that's really doesn't contain a significant supply. And the primary gut flora, lactobacillus, which is found in breastfed infants, it just doesn't synthesize sufficient vitamin K either. So without this vitamin, blood, it doesn't clot. And if there's a wound, that means that the blood doesn't clot and just flows freely. Infants can experience hemorrhagic disease, which is rare, but it is life-threatening. Again, when I talk about how important variety, balance, and moderation is, you can see that a lot of these micronutrients come from a wide variety of sources. If you look at the sources of vitamin K, which include green leafy vegetables, vegetable oils, meat, cheese, eggs, and soybeans, as well as it being synthesized in the GI system, you can see that a diet that has a lot of variety will hit a lot of these areas. And so, again, you can't have a varied diet every single day, but over a week's time or over several days' time, you can ensure obtaining a lot of different nutrients when you have a diet that's highly varied. Name 3 sources of vitamin B12. Shellfish, organ and game meats, fish, milk, and ready-to-eat fortified cereals. What is the impact of low intake of vitamin B12 on breast milk and on the baby? Well, since vitamin B12 crosses the placenta during pregnancy and is present in breast milk, exclusively breastfed infants of women who consume no animal products may have very limited reserves of vitamin B12, and they may possibly become deficient. And on the baby, well, undetected and untreated vitamin B12 deficiency in infants can result in severe and permanent neurological damage. In the past, these vitamins were primary. They received a lot of attention. There was a lot of movement in the government to focus on these specific nutrients. And now things have shifted a little bit as more and more research has been focusing on vitamin D as well as potassium. And so in different eras, different nutrients are spotlighted. And in the past, these were certainly in the forefront. And now, whether because we found out that, we've included them in enough processed foods or people are obtaining them more and more, our focus has kind of shifted to other nutrients. However, these nutrients are still critical. As you can see, maternal vitamin A deficiency, which is seen less in the US than around the world, does impact the amount available in human milk. Vitamin A is important for visual health, immunity, fetal growth and development. So vitamin C is also a critical nutrient. It's important in terms of fetal growth and development and overall health, as well as in immunity. And the needs for vitamin C are elevated during lactation. This is the end of Nutrition During Lactation, Part 2.